During the initial evaluation, ask them basic questions. Check for signs and symptoms. If you feel uncomfortable about how they are doing, take them to the emergency room, your family doctor, or call 911. Signs observed by teammates, parents, and coaches include: looks dizzy, looks spaced out, confused about plays, forgets plays, is unsure of game, score, or opponent, moves clumsily or awkwardly, answers questions slowly, slurred speech, shows a change in personality or way of acting, can't recall events before or after the injury, seizures or has a fit, any change in typical behavior or personality, passes out, loss of consciousness. Symptoms may include one or more of the following: headaches, pressure in head, nausea or throws up, neck pain, has trouble standing or walking, blurred, double, or fuzzy vision, bothered by light or noise, feeling sluggish or slowed down, feeling foggy or groggy, drowsiness, change in sleep patterns, loss of memory, doesn't feel right, tired or low energy, sadness, nervousness or feeling on edge, irritability, more emotional, confused, concentration or memory problems, repeating the same question, comment. 1. The law requires a student-athlete who may have a concussion during a practice or game to be removed from the activity for the remainder of the day. 2. Any athlete removed for this reason must receive a written note from a medical doctor trained in the management of concussion before returning to practice. AB 25/CIF 503H states that any athlete that is suspected of a concussion or head injury must be removed from competition, practice, or game at that time for the remainder of the day. If they have been removed from play, they may not return to play until the athlete is evaluated by a licensed healthcare provider, MD/DO. Then, they must have a written clearance to return to play from that provider. AB 2127 states, if a licensed healthcare provider determines that the athlete has sustained a concussion or head injury, the athlete is required to complete a graduated return-to-play protocol of no less than 7 days in duration, under the supervision of a licensed healthcare provider from the date of diagnosis. Meaning, if you get the injury on Monday and don't see a physician until Wednesday, that is the day when the 7 days begins. Again, if your child is vomiting, has severe headaches, or is having difficulty staying awake, or answering simple questions, or you feel uncomfortable how they are doing, take them to the emergency room, your family doctor, or call 911. www.riversidemedicalclinic.com, www.mysportclinic.org